It is my pleasure to introduce our keynote speaker, Dr. Bhadelia, who is an infectious disease specialist at Boston Medical Center and assistant professor of medicine at Boston University School of Medicine. Dr. Bhadelia is a graduate of Tufts University, where she has received 3 degrees. Her first, a BS in biology in 1999, and then she received a combined degree from Tufts' famous Fletcher School of International Law and Diplomacy, where she received a master's degree. At the same time, she was working on her medical degree from this medical school. As a matter of fact, this morning she mentioned to us that she remembers her white coat ceremony in her class exactly 15 years ago. So in those short 15 years, she's had a remarkable career, which we'll tell you a bit about, and you'll hear about from her. She's not stopping there. She told me that she's working on a master's in public health degree and is just a few courses short of getting that as well. She did her postgraduate training in internal medicine at Mount Sinai Hospital in New York and was the chief resident there. She followed up with a fellowship in infectious disease at Columbia Presbyterian Hospital. She has a background in health and human security with a focus on the impact of pandemics on macro-level health indicators and community security. She is presently the Director of Infection Control and Medical Response at the National Emerging Infectious Disease Laboratory at Boston University, one of only 6 such programs in the country. She specializes in infection control issues related to emerging pathogens and highly communicable infectious diseases. She has worked on projects with the United Nations International Strategy for Disaster Reduction and the Global Fund to Fight AIDS, tuberculosis, and malaria. Most recently, she served as a frontline physician providing care to Ebola patients in Sierra Leone with the World Health Organization. She is a senior policy and technical advisor to Partners in Health for their Ebola response program in Sierra Leone. She is also an instructor for the U.S. Center for Disease Control's Healthcare Workers Preparedness courses for the Ebola response. Her work has been broadly published, including recent publications in The Lancet and the New England Journal of Medicine. She's certainly one of our most illustrious young graduates, and we are very proud to have her here today as your keynote speaker. Thank you.
Dean Berman, Dean Kulik, Dean Curl, faculty members, parents, medical students, thank you for having me. I'm honored to be here with you as you receive your white coats today. As Dean Berman said, almost exactly 15 years ago, I was sitting exactly where you're sitting right now. And when Dean Kulik asked me to address you today, I thought about what I wish I had known, what I wish I had been told that would have made my medical education and my early career an easier path. So do me a favor, take a look down at your hands right now, students. Starting today, those are healers' hands. You will receive a lot of advice about how to train your mind over the next 10 years. I want to speak to you about something different. I want to speak to your physician soul, which minted today will have a long journey ahead of it and will face incredible amount of challenges and opportunities for growth. You have chosen a hard path. The work is difficult. The commitment will require a lot out of you, emotionally, intellectually, physically. Your 20s will be very different from those who graduated with you from college. Your friends and families will struggle at times to understand the demands of your schedule. Despite your best efforts, you will fail to convince some of your patients to take their medications. And having given all your best, some lives may still pass through your hands. Certain aspects of modern medicine will frustrate you, and you will grapple with stress that comes from being in debt. So after all that, you may ask, why did I choose this path? Why did I choose this path? What can I share with you from the last 15 years that will ring true when you're sitting awake at 4 a.m. on an overnight shift in solitude, in reflection, asking yourself the same question. The advice I'm going to give you today falls into 3 categories. First, exist in the present. What do I mean by that? At the beginning of our careers, our entire lives are focused and defined by our future plans. Planning for medical studies during your pre-medical years, planning and matching in residency and then in fellowship. In some ways, this translates into living for the future and sends the message that your life has not yet begun. And nothing can be farther from the truth. In fact, your life and everyone else's life only exists in the present moment. This is the basis of mindfulness, the state of active, open attention on the present. I could quote you the research that says, mindfulness leads to stress reduction, improves working memory and focus, improves cognitive flexibility and emotional state, all of which will lead to a better future. But instead, let me tell you that you should do it because a lack of resistance to the present moment will make you appreciate your life more. It will make it easier for you to become more aware of your own needs and make it easier for you to recognize the suffering of those around you, all of which will make you a better healer. In fact, this simple daily practice is the basis of all the rest of the advice I'll give you today, and you'll see what I mean as I go on. 2, know that what is being asked of you is a lot because what you signed up for is unique. All professional pursuits center around 3 elements: what you do, how you do it, and why you are doing it. Here are the what, how, and why of medicine. You have chosen the field that, if you are lucky, will intellectually challenge you every day of your life. Medicine, despite all its advances, is in its nascency. And every generation looks at the science of healing of the generation before and marvels at the progress that's been made, and sometimes laments the loss of some of its art. Whether it's human ingenuity or the continual new challenges posed to us by the natural world, the likelihood that we'll know everything about the human condition in the upcoming generations is small. And hence, as Socrates said, the only true wisdom lies in knowing that you know nothing. The best advice I have received regarding choosing the right field in medicine was from one of my previous mentors, Dr. Mary Klopman, who's the chair of medicine at Duke. Nahid, she said, the field of medicine will require that you keep learning every day. Choose a specialty which inspires you to read even after a long day on the wards or in clinic. Appreciate and enjoy this challenge. It will be the basis of your professional fulfillment. This is the what of practicing medicine. The bond you share with your patients, it will be unparalleled with anything else either one of you has in your lives. The trust that comes with the intimacy your patients share with you. There's a reason why it's called a privileged relationship. The grace and the depths of humanity that you'll witness will change you. At the bedside, you play the role of the witness, looking at the comings and goings of life with a capital L. Sometimes you will welcome new life into this world. And there will be other times when you're the only person in the room and you're the last soul that a human being sees before it leaves this earth. So it is your responsibility to treat all your patients as humans first. Appreciate the fullness of their existence and their unique struggles. Dr. Jerome Groopman, who has written extensively on physician-patient relationship, wrote, "The words and phrases we doctors use mold our thoughts and emotions, our actions and reactions to our patients and to each other." As you move through your career, be wary of reducing your patients to clinical cases. Be mindful of your words and actions, and know the impact that they have on your patients. Practice your art with empathy. This is the how of practicing medicine. As Dean Berman mentioned, over the past year, I've been involved in the Ebola response in West Africa. The journey has taken me through multiple epicenters of the epidemic in Sierra Leone and numerous stints of quarantine here in Boston. It has been the hardest and the most rewarding thing I have done as a physician and as a human being. It has also served as a reminder to me about the importance of the skill that we have been given and our ability to make a difference. I always tell the story of one of the patients in an Ebola treatment unit that I encountered last summer during my time in Kenema, Sierra Leone. I found an old man in triage area, a place where patients are brought in from the community because they fit the clinical definition of Ebola and wait to be tested. He was extremely ill. I found him along with a dozen other patients who were admitted in that day and were sitting in a canvas tent under the West African hot sun. I gave him oral rehydration and I kept asking him his name. "Sir, tell me your name so I can see if you've been tested," I said. He kept mumbling, and I kept trying to lean in closer to hear what he was saying. And when I could finally hear what he was repeating, it was, "I am nobody. I am nobody." When he saw the flicker of recognition in my face, he gave a sad, tired smile. To the most of the world, this patient was nobody. He was a nameless statistic recorded during the epidemic. But I will never forget that moment. It drove me to be an advocate, to speak out for more resources for the epidemic. I wrote something soon after that experience that I want to share with you today because, in retrospect, I think the sentiment applies to the entire sphere of our practice in medicine. There's a thunderstorm going on in here. This epidemic, is not one of nameless, faceless individuals living far away. It is the story of family members who expressed grief at losing their loved ones. It's about strangers who provide kindness at the right time to others. It's about children who wandered alone through halls of illness and then made it out alive and survived. It's about those who died in my hands despite my best efforts. It's about healthcare workers who buried their own and are continuing to work. It's about entire communities debilitated by this epidemic, and about countries that will see an entire generation affected by it. It's about putting your fear aside and doing what you know is the right thing to do in the moment. It's about you and me and what we do to stop this epidemic and the next one. You're handed a responsibility with the understanding and the training you'll be getting. As you heard, I spent almost a decade of my life at Tufts. And I can tell you from experience that you're at the right place to be supported and encouraged to be an advocate. Be a voice for good. Be an advocate for change, for the individual patient, and when given the chance, for a community. This is the why of practicing medicine. Lastly, be kind to yourself. Realize that despite everything that's being asked of you, you too are human. Be aware of the effects that stress can have on you and retain what grounds you. Seek it out. Continue your hobbies. Keep your loved ones close. Accepting your own humanity also means recognizing your own fallibility. By being able to admit mistakes, you improve upon your art and in the system in general. It's what's fair to your patients and your coworkers. In the book Complications, Atul Gawande writes, "No matter what measures are taken, doctors will sometimes falter. It isn't reasonable to ask that we achieve perfection. What is reasonable is that we never cease to aim for it. Never cease to aim for it. But remember, first and foremost, live in the present moment, and you'll be much better equipped to appreciate everything else that comes your way. So congratulations on your achievement. Welcome to the family. And thank you for allowing me to share my experiences today.